Hi, welcome to Chapter 2 of Introduction to Public Health. I'm Jeremy Whitaker, and let's dive in. Now, again, looking from 1900 to now, which is kind of the public health era, the crude death rate, or deaths per 100,000, has been halved since that time. Life expectancy has risen about 30 years. Infant mortality has dropped 95%, and a lot of that is because of modern surgical techniques, C-sections particularly. Also, maternal death has dropped, again, along the same lines. The causes of death: most people died from infectious disease back about over 100 years ago. Now they generally die from more chronic diseases. However, problems remain and things are not perfect. The definition of health has really shifted over about the past 60, 70 years, basically from saying disease-free was health, but now health is more about being able to do things. And so you can see that shifting over time. A lot of this chapter is about measures. And so you do crude mortality, infant mortality, or deaths per 100,000, or children who die before the first birthday. And these are per 100,000, so you can compare between states or between countries. So if everyone puts it into one form, it's easy to compare between different geographic locations. Years of potential lost life. That's basically if I die at 50, but the average life expectancy for if for a guy is 75, then I die, that's 25 years of potential lost life, which is good at measuring illness in a population. And again, life expectancy, again, a fairly crude number, how long you live. The morbidity or sickness measures, disability adjusted life years, that's basically how many of the years you lived were you sick. So if you were, let's say, went blind in your last few years, that's going to impact your quality of life, and those aren't considered full years from a disability standpoint. And then there's two other measures: incidence and prevalence. Incidence are the number of new cases. Prevalence are the total in a population. For instance, there are about 50 new cases of HIV diagnosed in Iowa every year. However, the prevalence of HIV is about 2,000 cases. So we have about 2,000 cases with the incidence being 50 new ones every year. And that stat is approximate. You need to look it up to make sure. Now, risk factors. It gives these 5 different risk factors, and they're pretty straightforward. As you get older, biological, as you get older, things you're born with. Environmental, things you're exposed to. Lifestyle, or choices. So when you think of lifestyle, think things you choose to do, the food you choose to eat, if you choose to buckle your seatbelt, if you choose to have protected sex. Psychosocial is a lot of it's cultural, poverty, things in your environment that aren't necessarily like contaminated water, but low income, and that impacts things. And of course, access to services, what you can get to. And then some other issues, just kind of cherry picked from the chapter. There's kind of these causative factors, and broken down what causes disease. You have the direct things that determine it's things that directly impact, but the other things that contribute to that happening. Global health, they kind of simplified it down to the 3 Ps of pollution, poverty, and population. Each of those 3 have, again, a huge impact, especially in developing nations. There's an interesting couple paragraphs. It talks about how 11% of total healthcare costs could be saved by investing in 6 conditions. So again, it's 20% of our national gross domestic product spent on health. Huge impact could be had by investing in prevention. And Healthy People 2020, there's a couple of pages on that. It's very interesting because that's really the blueprint for our prevention goals as a country. So looking at the homework, there are quizzes over chapters 1 and 2, a journal article where you're going to write about 400 words over the state and Blackhawk County health departments, and assignments, chapter 1 where you build a logic model, and this one for chapter 2 where you select a couple of things that you're interested in from the Healthy People goals in the book, and also in the homework assignment there's a link to the website that'll probably make it a little easier. Thanks for watching, and I'll talk to you all soon.